Dyspnea. Dyspnea is difficult or labored breathing in which the subject is conscious of shortness of breath, or it is an abnormal, uncomfortable awareness of breathing. A normal individual is not conscious of respiration until ventilation is doubled and breathing becomes uncomfortable. Real dyspnea, that is uncomfortable breathing, occurs when pulmonary ventilation is tripled or quadrupled. That is when an imbalance between demand of ventilation and actual ventilation is achieved. The basic mechanisms of dyspnea are hypercapnia and hypoxia. Hypoxia and hypercapnia result in increased rate and depth of breathing regardless of patient's subjective sensation. Increased effort of breathing or increased work of breathing, for example, in bronchial asthma where airway resistance is increased and compliance is reduced. Current hypothesis that dyspnea occurs when there is a mismatch between incoming afferent information to the brain and outgoing motor signals from brain to respiratory muscles. Some of the causes for dyspnea are where the disease originates from the respiratory system, obstruction of any part of the respiratory passage that is increases the work of breathing, for example, bronchial asthma. The disease of lungs or pleura, that is pneumonia, uh, pulmonary edema, fibrosis, pleural effusion, and pneumothorax. Then interference with respiratory movement, that is weakness or paralysis of the respiratory muscles, pain due to injury to the chest wall, ribs, or deformities of the spine or impaired movements of the diaphragm leads to dyspnea. Some of the cardiovascular causes are chronic congestive heart failure. Initially, dyspnea only on exertion, but later the dyspnea occurs even at rest. Then paroxysmal nocturnal dyspnea, which occurs in pulmonary edema because of the left ventricular failure. Some of the disorders of metabolism like metabolic acidosis, diabetic acidosis, uremia, and other causes like anemia, cerebral hemorrhage, and psychogenic causes, they are going to lead to dyspnea. Dyspneic index or breathing reserve percentage, it is a percentage of respiratory capacity not being used at a given resting minute ventilation or pulmonary ventilation. The normal dyspneic index at rest is around 90%, and hence breathing reserve is nothing but the maximum voluntary ventilation minus resting minute ventilation, that is, it is around 90 liters. Dyspneic index is calculated by the percentage of breathing reserve, that is, breathing reserve divided by mean voluntary ventilation into 100, where the MVV is maximum voluntary ventilation and RMV is residual minute ventilation or minute volume. This means that breathing can be increased by 90 liters, that is from 6 to 8 liters to 100 liters or more. Dyspnea is where when the index is less than 70%, which is called as dyspneic point. An example taken from a patient of emphysema will clarify this. The MVV has reduced from 100 liters per minute to 40 liters per minute, while RMA has increased 10 liters per minute to 20 liters per minute due to the respiratory stimulation by increased PCO2 and low PO2. Hence, dyspneic index will be around 50%. This means that dyspneic point has been crossed so that the patient is experiencing dyspnea.